All right, hey everyone. My name's Andres Enriquez. I'm an athletic training student at Florida Gulf Coast University, and this is my friend Jacob. We're gonna be going over the SCAT5, which is the Standardized Concussion Assessment Tool. Um, he's gonna be helping me in certain portions uh, of this demonstration. Um, so the SCAT5 is split up into two parts: the on-field assessment and the off-field assessment. So for the on-field or immediate assessment portion, there's a couple of steps. The first step is looking for any red flags. So that's neck pain, any tenderness along the neck. Are they unconscious? Are they breathing? Are they going through any seizures or having any double vision, severe headache? Are they nauseous? Things like that. That's the first thing you want to do. And then you also want to look at any observable signs. So, um, are they lying motionless? Are they moving? Um, do you see any abnormalities in their gait? Are they walking with a stumble? Things like that. Then you want to look facial expression. Or do they look like they're out of it? Are they alert? Are they able to focus? Then you're gonna move into the third step, which is your Maddox questions. Pretty much just kind of testing their memory. So you can ask them things like, where are we playing today? What's today? Who scored the last points? Um, did the team win the last game that they played? What sport are you in? Things of that nature. Next, you're going to get into the Glasgow Coma Scale. So for this part, you need to write down the time and the date of the assessment because you can do them at different time periods. So if you do it now, then you could do it 10, 15 minutes later on. You just have to document it. And then you're just looking at their eye response, their verbal response, and their motor response. Um, so things like, if is their eye opening to pain? Is their eye opening spontaneously? Um, is there no verbal response when you try to speak to the athlete? Um, is there any motor response? Do they have any extension of pain? And everything is rated 1 up to 6. So for the eye response portion, it only goes up to 4, 1 through 4. And for verbal response, it's 1 through 5. And then for motor response, it's 1 through 6. And then you do a cervical spine assessment, and that is when you're checking to see if the neck is in pain at rest. Do they have any pain with do they have any pain at rest? Do they have full range of motion? So do they have full extension, flexion, lateral flexion, rotation of the neck? You want to check that. And then is the strength in their limbs normal, and is their sensation normal? So you want to check their cranial nerves. You can check, just do a quick, touch them, ask them if they can feel it. Can they move their toes? Can they move their fingers? Something very quick. And then once you get them off the field and you're done with your on-field assessment, there's the off-field assessment portion. And um, first, there's some history questions. Have they ever had a head injury before? Have they ever been diagnosed or treated with headache disorder or migraines? Diagnosed with a learning disability? Uh, are they diagnosed with ADHD or ADD? Do they have depression? Do they suffer from depression, anxiety, any other psychiatric disorders? And all of these questions are yes or no. And the next portion, um, you would move into their symptoms. So for this part, you're gonna have your athlete read the instructions, and then they're gonna read off the symptoms, and then they're gonna rate their symptoms from 0, which is none, to 6, which would be severe. Um, Anything in between would be either mild or moderate. So then um, I'm gonna have my friend Jacob come on up. So then he's the possibly concussed athlete right now. So then I would just hand him the sheet and have him read off the symptoms, and then rate them. So we're just gonna give a few examples. So read a couple.
A couple?
Mm-hmm.
Headache. And I'm supposed to answer this, right?
Mm-hmm.
3. Pressure in head. 1. Neck pain. 0. Nausea or vomiting. 0.
Okay. And then you would just keep moving down the list. There's 22 in total, and then you would just write down the number of symptoms out of the 22, how many they had, and then whatever score they gave you for that symptom, you're going to total it, and it's going to be out of 132. And then while they're at the end of that, you're going to ask them if their symptoms get worse with activity, or do their symptoms get worse with mental activity. So if they have to think, does that cause their headache to get worse? Does that make their nausea worse? Did it make them dizzy? Did their neck pain get worse? Things like that. And then next you're going to move into the cognitive screening. So cognitive screening, so there's things like orientation, immediate memory, some concentration questions that I'm going to ask. So for orientation, for example, I can ask him, what month is it? And
May.
May. So then it's June, so that would mean that he got it wrong. So then I would give him, it's either based off of 0 or 1 if it's correct. So 0 if they got it wrong, and then 1 if they got it correct. So I'd give him a 0 for that. What day of the week is it?
The 2nd.
Or what day of the week?
Friday.
So Friday, he got that one right, so then it'd be a 1, and then there's 5 questions in total, and then you would just, whatever they got out of the 5 is what you'd put down. And then for immediate memory, you can either ask them, you're going to do it 3 times, and you're going to, or 3 trials, and you can either use a 5-word list or a 10-word list, but you have to do it 3 times, 3 trials each time. So then I'm going to read, so this is testing their memory, their immediate memory, so I'm going to read out the list of words, and then I want him to repeat back as many as he can remember in any order. And then for trials 2 and 3, I'm going to repeat the same list, and then he's going to do the same thing, repeat them back to me as many as he can. So finger, penny, blanket. Well, you have to wait until I'm done.
Okay.
So finger, penny, blanket, lemon, insect.
Finger, blanket, penny, insect, and that's it.
So then he got 4 out of 5, so I would put that down in the first trial, and then I would reread the same list again for the second and third trial, and then hopefully he does better, but whatever score he gets is what I'm going to put down. So and that's going to be, since you do it 3 times, it's going to be out of 15. And then you also mark down the last time you did the third trial. And if you did it if you used a 10-word list, then the score would be out of 30. So next would be his concentration. So I'm gonna say out some numbers, and then he's going to say them back to me. But he's gonna say it in reverse order. So if I say 1, 2, 3, he's gonna say 3, 2, 1. So I'm going to start off with, so you know how it is.
Yeah.
So 4, 9, 3.
3, 9, 4.
6, 2, 9.
9, 2, 6.
3, 8, 1, 4.
4, 1, 8, 3.
3, 2, 7, 9.
9, 7, 3, something, I don't know.
Okay. And then 6, 2, 9, 7, 1.
1, 7, 9, 3. I don't know, that's it.
Okay. 1, 5, 2, 8, 6.
Can you say it again?
1, 5, 2, 8, 6.
6, 8, 5, 2, 1.
7, 1, 8, 4, 6, 2.
A lot of numbers.
And then
Wait, hold on. 2, 1, 4, 6. I don't know. That's it.
okay,
Yeah.
you got some of them.
Yeah.
5, 3, 9, 1, 4, 8.
8, 1, 4, 9, 5, 3, or 5, 3, 5.
Okay, so he got that one, but they were out of order. And then each time, I don't know if you can see, but they're in columns. So each word, each number list is gonna be next to it's gonna be either a yes or a no, and that's gonna mean if they got it right in correct order, you put a yes. If it's a no, they didn't, then you put the N for no, and then you also it's either a 0 or a 1, so for scoring. And then so that's concentration, and then you're gonna do the months in reverse order. So now I want you to say the months of the year, but in reverse, so backwards.
I'm not that good. Okay. December, November, October, September, August, July, June, May, March. Wait, no, April, March. February, January.
Yeah. So then he got that
Hey.
all right. So then he'd get the full credit for that. And then just getting the months score, just getting the months in correct reverse order, that'd be just 1 point. And then the numbers for part of the concentration, that'd be worth 4 points. So together in that whole category, it'd be 5 points. And then next is gonna be a neurological screen. So this is pretty much just yes or no questions, asking like, does the patient have full range of pain-free passive cervical range of motion? Can the patient perform the finger-nose coordination test normally? Can the patient perform tandem gait normally? And that's what we're going to get into next. So with the balance examination, you want to mark down which foot is his, the foot that's being tested, which is going to be his non-dominant foot. So which leg do you kick with?
Right.
So then his non-dominant leg would be the left. So on here I would mark down his left foot as the one being tested, and I want him, since we're testing his balance, we're gonna do the double leg stance.
Double legs. I've never seen that before.
So just stand on two legs, and then so then if he's fine with that, then you're gonna go into the single leg stance. So he's gonna stand on one foot, which is gonna be his non-dominant foot. So stand on your left.
Oh, I'm a little drunk. I can't.
And then next is gonna be the tandem stance. So you're gonna put your non-dominant foot in the back. So his left foot's gonna go behind his right foot.
My left foot behind the right foot.
Yeah. And your hands on your hips.
2 or just 1?
Both.
Okay.
And then close your eyes.
Oh, straight.
And then
Okay.
so when someone who's possibly concussed, you want to always remember to stand next to them or behind them. That
Just
way
like
you
that.
can catch them in case they fall and have problems with their balance. So for him, if someone presented with problems doing that, then I would not give them the full credit for that. And those three, the double leg, single leg, and the tandem, are 10 points each, and in total it'd be out of 30. Delayed recall. So now I'm gonna ask him if he remembers that list of words that I gave him at the beginning. You remember
What
those words that I told you earlier?
I wasn't concentrating.
The one where it was finger.
Penny, finger,
Mm-hmm.
insect. I don't know. That's it. That's all I remembered.
Okay.
3
So
things.
I
I
used
know there was 5 words, I think.
So it was out of 5 words. So it would have been out of 5. He remembered 3 out of 5, so I would mark that down. And then next, once you're done with the delayed recall, that's pretty much the end of the evaluation. Now it's when you document your decision that you made. If you're going to, you're pretty much just writing down everything, all your results from the evaluation. So the number of symptoms, how they scored on the orientation, their score overall out of 132 in the symptoms, their concentration. So you're just writing down the scores for everything, and then filling in the rest. So if your diagnosis is a concussion, you're going to mark down either a yes or a no. And then you can also use the SCAT5 to retest, like I said earlier. So doing it in different time periods. And then if this was a retesting, then it's asking if the athlete has improved. You mark down yes, no, if you're not sure because of the results being about the same. And then that's pretty much it. And then you just sign it and date it, and then you're done. All right, thank you.